This technique is going to be a release for kind of the lower aspects of the glute, more down between where the sit bone and the tailbone are. So I'm actually going to be in this groove right here. So what I'm going to do is take the ball and set it on the ground. Really what we're going after are deep rotators in the pelvic floor a little bit. I don't know if I would really say it's the pelvic floor, but definitely the deep rotators. So what I'm going to do is wedge the ball right between my tailbone and my sit bone. And I'm going to get into kind of a crab walking position. And I'm going to roll through that area, trying to get really deep in there. You can see it's pretty low on my hip. So we're going to start the timer. Now, if I've got like a really rough muscle in there that I want to get on top of, what I can do is straighten the leg out and really lean forward and get as much downward pressure on it as possible. And I'm doing this all through feel. So like right now I can feel that there's a hot muscle in there, so I can do pin and pull by turning my foot. I can get back into more of a crab walking position and move my knee, or I can just keep surfing through the groove, trying to find anything that feels lumpy and bumpy right around either near the tailbone and sacrum, but not on it, or around the head of the femur. Really deep stuff in there. Like, I don't need to know the name of every muscle around my femur head to know what a hot spot feels like and to put pressure on it. So it's really more about exploring the area and applying pressure where it is within the frame of tolerance, but obviously needed. So for me right now, it's right there, right on that spot. So I'm going to wiggle my knee, and in this case, apparently, little internal rotation feels good versus external rotation of the knee. So, well, in this case, external rotation of the hip, internal rotation. Sorry, internal rotation of the hip, external rotation of the foot. All right, switching sides. So now I'm going to take the ball, place it on the other side, start the same process over. And I don't have any expectation that the two sides are going to feel similar. They might feel totally different. You may have, like, for example, I've injured this ankle many times. So this hip always feels different than the other hip because it's responding to different foot dynamics, because mechanically speaking, this foot isn't the same as this foot. So the muscles are going to respond differently. And I just want to work through that area, looking for sore spots, lumps and bumps. And if I find a good one, like I just did, I'm going to get on that and really focus on releasing it, but again, staying inside my frame of tolerance. Using pressure as a tool, not pain. I'm not trying to use pain as a tool. I'm trying to use pressure as a tool. And then, again, if you need to focus on your breathing, take big, deep breaths in through the nose. And then imagine you're blowing through a tiny straw. And then relaxing into it. Those long breaths help downregulate your nervous system, which is going to allow the muscles to relax quicker. So focusing on breathing really helps.